Hi, I'm working to get a process underway to review the many complaints that come in about family healthcare centers of San Diego on a daily basis. I was trying to do the most recent ones first. However, in reviewing these, I'm finding some that are a little bit older that make points that really need to be made. This one is not that old. It's posted by Tony C. Uh, on this year, June of this year, June 14th, 2021. And Tony apparently went to the El Cajon clinic. From context, I believe Tony is a female. I'm going to use the gender she and her for her. My landlady is the same way. She has the name Tony. It's pronounced Tawny for her. But anyway, um, she makes some pretty good critiques. The place is dirty and disorganized. Everybody uses the word disorganized. Appointments are extremely hard to get, she says. She called multiple times. Just general incompetence that everybody reports. The phone, she had to call a bunch of times to get, she had to make five phone calls to confirm her name and birthday before the phone appointment with just a nurse. Each person seems to not know that I'd called before. I mean, just this really standard stuff um, we hear all the time. She was given an ultrasound referral, a whole nother issue, but they obviously have a lot of problems in their prenatal, as well as multiple other departments there, mental health especially, other departments, especially drug prescriptions. But here's well, she got her referral wrong for the imaging. That always happens, it seems. The imaging, I mean, so many people report women going in for prenatal care report that the imaging just never was available. It almost makes me wonder if they even have it at all, or if they have such limited capacity that's just kind of a selling point. But here's her main point. What bugs me about this place is how they seem to not understand the concept of consent and patient-directed care. I had someone call me and tell me that they were signing me up for a pap smear because I missed mine. I said, super interesting, because I just started here and did you mean to ask if I needed help signing up for one? She did not seem to see the error in her approach of telling me what to do and asking about my records instead of telling me I missed one. Okay, that's kind of an obscure point, but that's gaslighting. That is the definition of gaslighting, and they're very good at it. Family healthcare centers of San Diego. You're treated like an object, not a patient. And even if you have a lot of experience in medical things, which I did not, people will tell you to do things. The most extreme example, of course, for me, I'll be telling this story on this YouTube channel, was Derek Aragon, a person I've never met in my life, a psychiatrist there, called me about resuming my mental health care center after they had abandoned me, and just started screaming at me that I was now being forced to take random urine tests. It was outrageous. I'll tell that story later. But this is I encourage you to read this because she really makes the point well. They also have no concept of respect for your time or asking for what you need. It's actually worse than that. They leverage your time. Wasting patients' time at family healthcare centers of San Diego is part of their business model. It's horrible. They do a lot of health damage to our community. I don't think anybody's really looked at the economic damage family healthcare centers of San Diego does to our community, but it's enormous. And she just said they were able, I know I was spoiled having scripts before, but this place is below the basic standards of professionalism and competence I would expect as someone who works in a medically adjacent field. I think what concerns me is my husband is in the next room working to switch our coverage, and the people that do not have an option are stuck here. This odd power dynamic with them telling you what you are doing with your body and time is super concerning and is not the standards for medical systems. Tony, thank you so much for posting that. That's exactly what happened to me. I was gaslighted. They did exactly that. They tell you essentially that they own you. It came to its most extreme point when I met with Joseph Palvita, never in person, and a brief online conference. where he lied his ass off and then he falsely claimed he was my psychiatrist. They're doing it for money and billing. The federal government apparently does not regulate or oversee this in any way. And if they try to, the staff of that family healthcare centers has learned how to game their system. It's a horrible place. Tony made one of the most important points. They do not believe in patient consent. We've got to do something about it. Thanks for listening. And Tony, thank you for posting this. It sounds like you did find some good healthcare. Congratulations. But thank you for thinking about the people that were left behind.